Lameness from injury to tendons or ligaments or osteoarthritic disease can compromise the quality of life of horses and is a major concern to owners. Today, thanks to Pall's Equine Platelet Enhancement Therapy, simply known as EPET, veterinarians can rapidly prepare and deliver a high-quality platelet therapy stall-side without the use of a centrifuge. This natural therapy is derived from a small volume of the horse's own blood and takes about 30 minutes to prepare, filter, recover, and administer. This video provides instructions for use for the EPET kit. EPET uses advanced filtration technology to concentrate platelets from whole blood. The elements of this procedure are simple. First, blood is added to the top bag, and then passed through the EPET filter under gravity. As platelets reach the filter, they are retained through a complex interaction of size exclusion and adsorption. When the filtration is complete, the filter is isolated, and a harvest solution is backflushed through the filter to recover the platelets. This harvested product is the platelet therapy and is ready to use. Now, let's look at the details of this procedure. The Pall Animal Health EPET kit provides the sterile, disposable equipment you'll need to create a platelet therapy from autologous equine blood. The kit includes the Equine EPET filter set, a vial of anticoagulant solution, a vial of capture solution, which is sterile water, and a vial of harvest solution, which is a mildly hypertonic saline, 3 10cc lure lock syringes, 1 60cc lure lock syringe, a sterile surgical drape, and instructions for use. Other equipment you'll need for the procedure include clippers and surgical preparation for the aspiration site, 1 needle for aspiration of blood, 3 needles for aspiration of the anticoagulant capture and harvest solutions, preparations for sedation and nerve block if necessary, and post-procedure materials like bandages and ice packs. The procedure is simple but precise, so you may want to keep the instructions for use nearby for easy reference. Put on gloves and then place the clean drape on a steady, flat surface. Remove the EPET system from its packaging and hang the system from a convenient surface with the arrows pointing down. Before proceeding, push the top and the bottom clamps into the closed position. These are left open during shipping to prevent excess crimping. Closing the clamps before you start is critical for the system to function properly. Fill 1 of the 10cc syringes with 9 cc's of sterile water for injection, the capture solution. Remove the cap on port A, which is a needleless valve. To ensure a proper connection with the needleless valve, follow these 3 simple steps. Insert the syringe into the port. Applying gentle forward pressure, twist the syringe counterclockwise until you feel it drop into the grooved threading of the valve. Once seated, twist the syringe clockwise until it is fully engaged in the valve. Inject the capture solution into the bag and then replace the cap on port A. If you feel any resistance while injecting the solution, withdraw the syringe and try again. Preload the 60cc syringe with 5 cc's of the anticoagulant solution. When drawing blood, the access site along the jugular vein and needle size are at the discretion of the clinician. The goal is to collect 55 cc's of blood for a total of 60 cc's as quickly as possible to avoid clotting. Once collected, remove the cap on port A and transfer the anticoagulated whole blood to the top bag, while gently rocking the bag to mix the blood with the capture solution. If you feel any resistance while injecting the solution, withdraw the syringe and try again. When the transfer is done, remove the syringe and replace the cap on port A. Remove the EPET system from its hanging position and continue to mix the blood and capture solution by inverting the bag 10 times gently over a period of about 20 seconds and avoid foaming. Good results require that the blood sample and the capture solution are well mixed. After mixing, rehang the ePet system in the same vertical position as before, making sure the bag with blood is above the filter and the arrow on the filter points down. Open the clamps above and below the filter. Ensure the tubing is not crimped and that the path is clear, allowing the blood to flow through the filter into the lower bag. The filtration process should take between 5 and 15 minutes. This gives you ample time to prep the injured site for the therapy. The filtration is complete when the flow has stopped and the unprinted side of the filter has drained. Now we're ready to recover the platelet therapy. First, close the top and bottom clamps. Next, fill one of the 10 cc syringes with 8 cc's of the harvest solution and attach it to port C using the simple 3-step technique we discussed earlier. Ensure you are using an aseptic technique by changing your gloves. The final sterile syringe is used for the collection and delivery of the platelet therapy. Take this syringe and depress the plunger to remove any excess air. Then attach it to port B using the same 3-step technique. It is critical that both of these syringes are properly connected. If the valves in the ports are not fully engaged, they will not open. Holding the filter with one hand, inject the harvest solution through the filter with constant pressure. This should only take a few seconds. If the plunger doesn't depress easily, stop. Remove both syringes, reattach them using the 3-step technique, then inject the harvest solution through the filter. The contents of the filter will backflush into the empty, sterile 10 cc syringe attached to port B, resulting in approximately 7 cc's of product. This is the platelet therapy. It is now ready for use and should be administered as soon as possible. For more information, visit our website at www.pall.com/animalhealth.